Great. Welcome, everyone. Let's get started. First of all, let me quickly introduce myself and everyone else on the call. My name is Cindy Zhao. I'm the Alumni Club President from Alumni Club of China. We've been organizing the series of Zoom meetings to keep all alumni engaged. And we received a very good feedback. So, we are rotating different topics. If there are different topics you are interested in, feel free to share with us so we can probably arrange relevant topics in the future. Today on the call, we have a great pleasure inviting our alumni Li Ma to join us and share with us a very interesting topic during COVID season, which is the topic of digital healthcare. I'm going to introduce Ma Li a little bit. Also on the call, we have CK Han and Lanera, who both work at the Alumni Relations Office. And we really thank them for helping us organize this webinar. So today's call, we received 148 registration with the majority of the alumni from worldwide working in the relevant healthcare industry. Even though the format is a webinar format, feel free to ask questions in the Q&A box. You're gonna see on your computer or your phone with a Q&A kind of a box. And we will go through your questions after Dr. Li Ma's presentation. So with that, we're gonna get started. I will give you a quick introduction of Li Ma. Li Ma is from Chicago Booth, graduate of 2007. She's currently Vice President of Alibaba Health, responsible for company's strategy, investment, and collaboration with external partners, supporting e-commerce, internet health, private insurance, and big data business for Ali Health. Ms. Ma has been working at McKinsey for 7 years as one of the core members of Greater China Healthcare Practice, serving both multinational companies and the local healthcare companies on a wide range of topics. She has led collaboration initiatives with different associations in China healthcare industry. Li has published a series articles on China healthcare talent magazine on China healthcare reform. Before joining McKinsey, she worked as a software engineer and project manager at Oracle Corporation. So with that, I'm gonna we're gonna invite Li Ma to start her presentation. Please get started, Li.
Okay, thanks, Cindy, for arranging this. Hi, everyone. Good night, and probably good morning to colleagues around the globe, right? So today I'm gonna talk about digital health, which is a hot topic, obviously, and also in light of COVID, right? People talk more about this topic. But let me share what we have been seeing and what we are thinking about this whole dynamic. Because I'm working for Alibaba Health, which is a publicly listed company, so I cannot talk much about our company itself, but rather focus on the industry and the whole market. Okay. I prepared for the presentation and quoted some of the reports. So I will acknowledge, some McKinsey report, some ACUA reports, right? Okay, so let me start. And probably I will spend 30, 40 minutes to talk about what I have been preparing, and also glad to discuss with friends like you guys, right? Okay, so let me first start with a little bit, broader background. So this is what we are very familiar with, right? Internet is reshaping the way of life in China. No matter the number of internet users or the different scenarios of our everyday life. I don't think I need to spend much time on this because people are very familiar with every single aspect. We are using our cell phone, and how painful we are if the battery is gone, right? So I just listed some of the apps on the right. This is only from Alibaba family, right? But you already can see, shopping, payment, commute, blah, 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 right? So this is what we are facing and experiencing in our daily life. However, if we change our aspect, if we think a little bit through the human society angle, right? Looking into, the past 200, 300 years, we started to realize that the human society has gone through 4 industrial revolution, right? Started from the first one featured by the steam engine creation. The second one, we called it energy revolution, which is featured by the electricity usage. And the third one, computation revolution. So wide use of computers, right? And specialized computing, right? And currently, we are not exaggerating. We are experiencing the 4th industrial revolution, right? We call it digitalization revolution, right? It is featured by cloud computing, big data, and AI, etc., right? So every single time, the technology is driving the revolution, and also every single time, human beings, the power of human is accelerated. Yeah. So this is the sort of the macro background we are in, especially from the technology side, right? At the same time, because we are talking about healthcare today, so we are facing, especially China is facing a tremendous challenge. One big factor is population aging. So this is the kind of showing you the population structure. So you notice that only during the past several decades, the total structure of population in China is changing. And we all know that, starting from like people entering 50s, they started to be caught by chronic diseases and cancer, blah, 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 right? They start to be good friends of doctors. Yeah,
Hi,
that is the reality.
sorry
right?
for interrupting.
Yeah.
You wanted to share your screen with us? Because people are saying they can't see the slides.
Ooh, hold on for 1 second. I think I'm sharing. Hold on for 1 second. That's strange. Probably I will log out and log in, because I think I am sharing. Sorry, let me see. So let me log out and log in real quick. Okay.
Okay, sorry.
Yeah.
In the meantime, how is everyone doing? I see that we have alumni joining us from pretty much everywhere, Chicago, China, Hong Kong. The good thing about organizing this event at 9 p.m. China is that we can get pretty much everybody to join us. Okay, Lee is
back. Yeah.
Okay,
and,
welcome.
Again, sorry guys. Hold on. Is it better now?
No.
No.
It was working earlier when we were doing the test.
Yeah.
There we go. Okay. It's working.
Yeah.
Perfect.
Okay. Yeah. Does it work?
Yes, it's working.
Okay, cool. You can see the animation, right?
Yes,
because
we can.
This is my favorite. Okay. So we talked about the population aging, which imposes tremendous healthcare challenges to China, right? And don't need to say that, you know, the explosion of chronic diseases partially comes with the population aging, partially comes from the lifestyle changing, right? The like diabetes, hyperlipidemia, hypertension, and you know, every single chronic diseases, you know, you name it, is easily the patient number goes to the total population of US, like hypertension, right? And the total population of the several biggest European countries combined, right? So this is what China is facing. So we call it China has not getting rich, but already getting old. So this sentence, let me repeat it again. We are not getting rich, right, before we are getting old. So this is very, very challenging, right? And I haven't talked about other challenges like the lack of qualified doctors, enough doctors, right? The unbalanced distribution of medical resources distribution, and also the ineffective way of using the resources, right? All of those imposes great challenge, right? So I have been talking about digitalization revolution and specific challenges in healthcare in China. And here comes from COVID-19, right? And COVID is not only, the virus, the healthcare problem, rather it imposes, more fundamental impact to the whole society, right? Ranging from technology competition, how government, right, wield their control over the society, and also the globalization, right, and the new consumers represented by Generation Z, right? They represent the different ways, new ways of consumers, right? So all of this, right, imposes different challenges from different angle. And of course, health is one of them. And you can say it is at the center, right? And what are the impact of COVID on healthcare, particularly in China, right? I think, my summary is like this. The drivers are the slowing down of economic and contracting government funds in healthcare, right? So that is for sure, right? So people expect the GDP is going down to 1% or 2% this year in China, and maybe contracting globally, right? With the slowing down and contracting the funds, a shift in allocation of funds, right? Prioritization first line of defense during like the COVID, right? The breakout, right? So we have to put other items behind, right? And also data connectivity is growingly a key priority, right? So these are the macro drivers. And what we expect are around the 4 items on healthcare in China, right? One is volume-based procurement. I'm not sure, how many people are familiar with what is going on in China healthcare, but volume-based procurement is one of the biggest initiatives to control cost by the National Healthcare Security Administration nationally, right? And with the breakout of COVID, at first people think maybe the priorities of the government will be shifted as the response to the outbreak took center stage, right? And volume-based procurement may be slowing down because before the COVID, it was the priority in China, right? But the latest announcement says that it is the opposite, and even more aggressive push by the government, right, with expanded product scope. So that's the VBP, right? The second item is provider reforms. So the government has invested for a long time in tiered healthcare, but with limited success, right? As COVID-19 comes, as travel registrations and healthcare resources redistribution, the patients are forced into local and lower tier hospitals. So we can see that, with COVID-19, the tiered healthcare system may be accelerated. And by the way, it is, the focus from the China government, right? And the third one is greater localization. It comes from the concerns of the high dependency on global supply chain, right, of the medical products such as the mask, right, as simple as mask, and all the way as complicated as, the respiratory machine, right, AMCO, right? So people in the government are thinking about how to do full-fledged local supply chain to make sure, if something goes on wrong, right, we do not depend on others. I think this is not only China government. I think all of the, different countries are thinking about the same thing, realizing that the globalization, the global supply chain is kind of risky, right? And a fourth one, the digital health, right? And, we have already seen COVID has caused massive acceleration of the adoption of digital health. So we have been talking about digital health for years, but we see that the fast path, during the past several months, maybe exceeds the, the progress during the past several years. And in US, there are some numbers, right? Before the COVID, the percentage of the consumers or the potential patients, they're interested in using telehealth. There's only 11% before COVID, but after it is 76, right? It's a humongous jump, right? People started to think about, if I cannot go to visit my doctor, right? What should I do? What I can do online, right? From the provider side, there's some survey, right? The number of telehealth visits goes up to from 50 to 175-fold increase during the past months, right? And the percentage of the providers viewing telehealth more favorably, it accounts for more than half, right? So as you all know that the physician group is kind of conservative, right? They are risk averse, right? So, you know, this is a big jump. People are thinking about, you know, telehealth is favorably. And in China, it is similar. Physicians registered for online consultation, right? For them, the number of patients served per week, right? The dark green is online. And before COVID, every week, those physicians served 35 patients per week, while offline is more than 100. But after, it is the opposite, right? You can see that the online patients already exceeds the number of offline, right? And also the number of visits of National Health Commission hospitals. There are 44 big hospitals, you know, attached to NHC. They started their online services. So before the COVID and after, if you combine, there's a 16-fold increase, right? So you can see that the COVID already, you know, accelerated the adoption of digital health. So that is from the market side, right? From the government side, this is a subset, right? From less than 2 months, starting from the first breakout, you know, you can see the government released at least, this is 11, right? And this is only a subset of policies pushing for digital health. So it is the yellow ones are the policies promoting telehealth, and the green ones are promoting the data infrastructure, and the blue ones are promoting the public insurance covering online services, right? So these are big jump, right? So you know, there have been discussed for years that whether and how the public insurance should cover online services, whether it should, right? And during the past months, there are a couple of important insurance policies saying that, you know, online healthcare services should be covered. Of course, there are some prerequisites, right? But at least there's a green light by the government, right? And also there's clear promotion for the healthcare service providers saying, you know, the online healthcare service is promoted. And before, only the follow-up visits are allowed online. But during the COVID, the first visits are allowed. And of course, for chronic diseases, it is encouraged for the long-term registration, because in China, you know, every prescription for chronic diseases has the upper limit. For example, at first only allowed 2 months amount of medicine are prescribed. And later on, it's relaxed to 1 month. But during the COVID, up to 3 months, the longer term prescriptions are allowed. Right? So these are the changes from the government, right? And as a summary, right, we can see that there are different buckets of players in this area. I won't go through them one by one, but in general, there are ranging from medical supporting services, for example, the hospital registration, to online consultation and chronic disease or health management, and also the e-commerce of the healthcare product, especially the drugs, right? The prescription drugs are allowed by the e-commerce, through e-commerce platform, starting from last December. Yeah. And also one big group is big data and AI. So different players are playing through their advantage. But I think there are three major trends in digital healthcare going forward, right? These are the current players, but going forward, I think these are the three trends. One is the online healthcare services expected still growing, right? But with online to offline streamlined experiences, right? Currently, there's only, online is online, offline is offline. They are separated, right? And people are criticizing, right? For example, the online consultation, they're light consultation, people say, right? It does not really solve patients' problem in some situations, because as all we know that healthcare cannot depend, it's always depends offline, like the lab results, the CT, MRI, or even operation room procedures. Of course, they're all offline, but the pure online services, it is limited. Right. So the first one, I would expect that online and offline will go together. Right. The second one is the treatment-centric healthcare models will be replaced by the health maintenance model. So what does that mean, right? In China, we are focusing on treatment. Right? People get sick and they come to the hospital and the doctors treat them. And before they come to the hospital and after they leave the hospital, nobody really cares them, right? And this will change, and especially with the help of internet and with the help of wearable, the smart device. Okay. And the third one is the usage scenario-centric AI application. We do not talk about AI application in healthcare, just it's a standalone AI application. We don't think it works. We stress usage scenario-centric AI applications. I will explain what do I mean, right? And for the first one, the first trend, right? This, triangle shows roughly how many hospital visits per year in China, right? So totally there's more than 8 billion hospital visits, or healthcare institution visits, not only hospitals, but like the grassroots institutes, all counts, right? And about 3 to 5% are critical diseases. By critical diseases, I mean, they have to be inpatients and maybe some, procedures or some really, complicated treatments, right? And the second tier is complicated diseases, meaning that it's quite complicated, but not, have to be inpatients, right? And it accounts for a little bit more than 10%. And then the bigger ones are the quick and light diseases. This is, what I caught. Maybe it's not, professional, but what I mean is like cough, running nose, diarrhea, these, frequently seen and not very severe and not very complicated diseases, right? And that accounts for 40%. And then chronic diseases. As I said, because the limitation of the prescription timeline, the people with chronic diseases have to go back to the hospital every month or every other week to get prescription. So there's a lot number of hospital visits accounts by the chronic diseases. So that accounts for 45 people. And interestingly, the light and quick and chronic diseases, there are a huge percentage of the patients or hospital visits do not need lab results or tests, right? So pretty much, with serious consultation, there are a lot of them can be solved. The problem can be solved, right? So I would say that these people, they probably will either go to offline, go to primary care institutions, which is promoted by the healthcare reform by the government, right? We call it, tiered healthcare. We just mentioned a couple of times already. And partially, they will go online because some of them can really be solved online, quick and, convenient, right? So this is why I think, the online consultation or prescription will be growing continuously. And if you look at a lot of, players, they provide, some online healthcare services. I just listed five buckets of them, right? This is an example of how it looks on app on your cell phone, right? For example, the online registration, you can get it registered. You can get yourself registered, right? Through an app, or you can choose a doctor and talk to them either by phone or by typing your question or symptoms, right? So these are the online consultations format, right? Even though online healthcare services is widely used today, I think it is not. It has their clear limitation. As I said, for example, if the red boxed ones, right? Registration or consultation, right? So they are quite separate. Even though it's online, it is not combined with offline other activities, right? So what we are thinking or I expect to see is that, the whole process in the green box and in the black box, this is the whole procedure or process people go to see their doctors and get their problems solved, right? And some of the steps can go online and some of the steps has to be offline. But we do see that the trend that the online and offline are coming together and streamlined to one procedure, right? So that is a trend, right? But of course, it has the challenges. It requires a lot of information system connected, right? Right. So this is the first trend. As an example, right? The e-prescription. So the first time, if the patient go to hospital visit and the physicians prescribe, and they either pay online or offline, and if they choose to use the cloud pharmacy, the product is delivered to them, right? But the second time, when they choose to get their medicine refilled at home, instead of going to the hospitals again, they do it online. And the online doctors do the prescription, and also with the pharmacy confirmation, etc. And they go pay online, and also the product is delivered. But what I want to stress is that at the cloud pharmacy, not only the prescription management, right, the safety, etc., but your EMR, the electronic medical record, your insurance policies in record should be stored and should be connected. That is what I mean by online, offline, streamlined, right? And a second trend, I would say, is that the treatment-centric model goes to the health management model, right? So this is the current model, right? People get sick and they go to the hospital, right? This is within the hospital, and doctors get them diagnosed and treated either by drug or by procedure, right? But before and after they get out of the hospital, nobody can reach them and nobody can give care, right? So this is treatment-centric, right? But I think this is not a new concept. This is from WHO data, right? If a population's health is 100%, right? and 60% contributes to the health is, lifestyle and self-management and health management, right? Only 8% goes to healthcare, right? This number is, is shocking to if you first see them, right? People think doctors can help me to get healthy, but believe me, they are not, right? Yourself or healthcare management can. And also there's a well-known rough number, right? If the government spent $1 on prevention, and if you do not do prevention and get to 6th stage, right? If you cure the disease, you need to spend like $8 to $9. But if the patients get to the critical disease, right? The healthcare system has to spend more than 100. So 1 to 8 to more than 100. This is the lever, right? So healthcare management, and that means that you spend $1 at prevention, right? So you get the best, value out of the dollar. So what could be changed to, and also this is promoted by Healthy China 2030 initiative launched by the government, right? So it is the health management centric model, right? The patients is here, and if they are sick, they go to the hospitals, and even before they go to the hospitals, they do physical checkup, annual checkup, for example, right? They do wellness, the physical exercise, right? All goes to around and designed for the patients, right? If they get some, quick and light disease, right? They get doctor online service, right? And after the visit, after the hospital visits, the chronic disease management, for example, the drug delivery, etc. PBM, sort of, if you will, right? The services goes to the patients, and also the rehabilitation goes to the patients, right? So I mean that this is a holistic health management model, right? This can be done by the help of internet technology, and also like the wearables, smart devices, right? Before that, right, before all those technology comes into use, it's quite hard for the patients to really know what's going on of the patients if they are at home, right? But with all the the smart devices, and we do see quite some are come into use, right? So I think this is, at least in the longer run, this has to be the model. And a third trend is I call it usage scenario centric AI application. So don't need to say that the digital technology development, creates innovation opportunities in healthcare, right? All the wearables and the healthcare data, like China is going through the healthcare IT revolution. So we do see the explosion of the healthcare data, and the cleaner data or more structured data comes into use or being recorded. And also the computing power is increasing, the cloud computing technology, right? And all empower the mining big data, and also the AI technology. So all these set the stage of, or background of, how to use or create AI technology, to use the AI technology, right? And I will jump into this, but what I mean usage scenario centric is, our perception is that in terms of we created an AI application used in healthcare. So what is the most important, right? We would say that usage scenario is the most important. It is more important than data itself, and it is more important than technology itself, right? Because people say, you know, yeah, you're Alibaba, you have technology so that you can do healthcare AI. You know, this we don't agree, right? We think, you know, the user scenario is the most important because unless you have the say AI engine created and really used by the physicians, you do not change the behavior of the physicians and they use it happily, right? It is embedded in their workflow. They can start to use it, and then your engine can get smarter and smarter, and you can collect the data. It's not the other way around. It's not saying that I have, you know, the super technology, and then I collect the data or purchase data, even, you know, some companies, and then they say I create, you know, the AI and force the physicians to use. That does not work. That means, you know, this is what I mean, usage scenario centric, right? And just to give you one example, oh, by the way, I skipped this. So, you know, we summarize that along these 5 lines are the most commonly seen AI applications in healthcare, right? Like the medical record structuralization. This is a basic technology. It is based on NLP, but it is far more than NLP, right? Because a lot of, you know, the medical terms and medical logic behind them, between them, right? And the second would be the image diagnosis. There are quite a lot of companies doing that. And physical signal diagnosis, there are 2, you know, quite a few doing ECG, for example. And medical voice recognition. Yeah, this is used in some particular scenario. Again, you know, every single, you know, dimension has to bind with different usage scenario. We use this, you know, voice recognition in some labs. The doctors are looking into the microscope, and they do not have extra hands. You know, one hand they do they record on the on paper, right? Or they draw some charts, so that they do not have extra hands to type in. So in that scenario, they speak, and we recognize what they speak, right? And you know, so this is a special usage scenario. Yeah, and also the medical knowledge graph technology. I will give you one example what we did on that, right? So again, go back to scenario. This is what a you know, the diabetes AI engine created us with in a KOL called Ningguang. He is the Ruijin Yuan, yeah, so which is the top hospital in China, and he is the KOL in the diabetes in China, so very famous and well respected. So we work with him to collect the classic medical cases from his real world work, and you know, do the you know, knowledge graph, and of course some other technology, and come up with the AI engine. And that AI engine is deployed in the grassroots institute. So for primary care doctors in China, that layer is quite weak, right? And they need to see, and they are seeing a lot of diabetes patients, but because their quality is not consistent, so you know the patients are not well managed. So with this engine deployed with the spirit or experience, if you will, of Ningguang, and deployed in each of the grassroots institute, so the primary care doctors can use them as a supporting tool for them to get their treatment plans, right? So we had an interesting competition. You know, one side is class 3 hospital doctors, and on the other side is primary care doctors, you know, helped with this AI engine. So, you know, the KOLs throw out the patient cases, and asked the two group of doctors to come up with the treatment plan. So the result is the primary care doctors helped with the AI is almost close to the class 3 hospital doctors. Still, you know, the class 3 hospital doctors won that competition, but it's really close. Yeah. Right. So that is about what I want to say today. Yeah, I will stop here. And you know, if people have questions or interesting, you know, topics want to discuss, you know, let's do that.
Thank you, Lee. That's very insightful. My first reaction is we should have done this much earlier because in the beginning of the COVID, I bought a stock on digital healthcare, Teledoctor, but I didn't hold it long enough. So it actually already went up more than 60%. So anyway, so if anybody have questions, please feel free to post it in Q&A. So we will go through the questions. And I have a few questions. Let me ask. Actually, it's the first question you probably already answered, but I wanted to make sure. Obviously, COVID-19 has really pushed digital healthcare ahead much quicker than normal. Do you think the volume picked up by COVID-19 will continue? Or do you think it will sort of slow down a little bit before it you know, get to the kind of scale which matches with what the infrastructure can provide?
Mm-hmm. Yeah. So that's a good question. I think it will slowing down. That's my first reaction. Give you an example, right? So during the COVID, the large hospitals in Beijing and Shanghai, for example, Anzhen Yiyuan, right, well known as you know, 心血管, is a you know, the top hospital in this area. More than before COVID, right? More than half of the patients are from the other parts of the country. It's not from Beijing, right? And during COVID, all of these patients cannot come, right? And you know, I believe the hospital had told me that only 30% of the patients, comparing to pre-COVID, is what they are experiencing. But once the COVID is controlled, people are coming back, right? There's some selective procedure, for example, it's not, you know, the emergency operations like this, the selective operations, people can wait, right? Once they wait till they can travel, they still choose to come to Beijing, right? So I think you cannot use the peak number as the norm going forward. But what I say is that first, it pushed the awareness and also the experience, both on the physician side and the patient side, trying online, right? And also they are pushed to the lower tier hospitals, which are, you know, during the COVID, but which are the priority of the government anyway, right? So I would say that it's a big event, but you cannot use the peak number, right? Yeah.
And we saw that Alibaba Health was really trying to share a lot of practice from China's fight against COVID-19 with the rest of the world. Can you maybe introduce a little bit about specifically what you did and how is that helping other countries fighting COVID-19?
Okay. Yeah, so I led that program. Yeah, of course I can answer that. Well, that actually was initiated by Jack Ma, right? Starting from the COVID, I think he got some donation or help from his friend outside of China when Wuhan was in trouble, right? Once we are in control and other countries started to get into trouble, Jack Ma started to launch a program donating PPE like the mask or respiratory machines, etc., to different countries, right? That is physical donation, and also he thinks the experience sharing would be critically important, right? So he started the online platform, and we organized more than 20 online discussion meetings with China doctors, with doctors in different countries, especially in Africa, in Southeast Asia, and in like the Russia and several the Shanghai Corporation countries, right? So people there, I think the value is tremendous. For example, we got some feedback saying, thank you for the meeting yesterday. We're starting to set up our fever clinic after that. So you can see that they do not even have the concept of setting up separate fever clinic. So all the patients goes together, and how much cross infection that will lead, right? So as the physicians in China shared what we did in China, how to control the chronic cross infection, how to manage hospitals, like prevent the doctors and nurses get infected. All the experience are very valuable to them. Yeah.
That's great. I mean, this is not just for any country. We need to fight this together.
Exactly.
My third question is that, in general, private companies tend to be more innovative, speaking of digital healthcare. However, in China, a lot of the data are still controlled by public hospital, which is in general government owned. So the data is very fragmented versus, as you mentioned, digital healthcare is more about health management, which is a very integrated system from the very beginning of lifestyle management. So you are in the industry. How do you think it will be a best solution to solve the very fragmented market in the China healthcare system?
Yeah, this is an even challenging question, I think. And I think this problem is not unique in China, right? The other days I talked with somebody in US and say, hey, you tell me that China data is fragmented. Let me tell you how fragmented it's in US. So it is not unique in China. However, I see several big efforts from the government, right? Let's start with the government, right? Like 12 in the 12th five-year plan, the government already very clear announced that healthcare information system is one of the pillar to support the reform, right? So they started to mandate the local government to connect the different hospitals to report some data through some defined format, right? So this is at least one step. But I agree with you that a lot of public hospitals, they do not have the incentive to connect with each other, especially the top ones, right? And I do not think by some mandate will quickly solve this problem. I would say that is a combined solution. So one was the government push. The other thing is we need to find the usage scenario. I'm sorry, I kept getting back to this word, usage scenario of the data. For example, if the patients themselves, they want to get their data, say for example, I want to get my test result data out of the hospital and you know, store somewhere so that I can get the second opinion from the hospitals on doctors online, right? Or I want to get the physical exam data and want the doctors to explain what does it mean by my annual checkups, right? So this kind of scenario, usage scenario, will be the scenario, you know, the patients download their data. And of course, you know, there will be clear guidance on the privacy policies and how to use the data. And but what I say that, you know, the data does not come together by themselves, and they do not come together only by the mandate of the government, but through a combined you know, the approach, right? There's some user scenario to help or provide services. If you provide a service has to use that data, right? The data comes, right? Yeah. But of course, you know, I think one of the headache is, you know, in the history, in the industry, it does not have clear guidance on what data can be used, protective data and non-protective data, right? In US, there's clear definition, but in China, I think the Wei Jianwei has already worked on the standard or rules, if you will, for years, and we are expecting the clearer guidance. Yeah.
Thank you. Let's go through the questions asked by the audience. Let's go to the Q&A box first. So the first question is, what do you think will be the provider of health management? Pharma companies, hospital, or technology giants?
Yeah. Well, I think the one of the big solution is family doctors. Even though primary care doctors in China, that layer is weak. However, the government has a clear push on primary care doctors, has this you know, family care sort of function, right? They have to like 签约, like they register with the patients in the community and do chronic disease registration and also checkups, right? This sort of the basic actions are mandate from the government. And I do see there are some places the government allow the primary care doctors, they provide extra services to get extra pay. So that way, in some places, we do see that the public healthcare institutions, primary care doctors, they act as a health management provider. I don't think PharmCo should do that because they are naturally not in the position of managing patients, right? So I don't think their compliance will allow them to do that anyway, right? And for the hospitals, say what kind of hospitals, right? If it's a really top tiered hospitals, I don't think they should do that because that is the unsmart use to use the resource. They should focus on most complicated or critical diseases, right? Rather than the health management, right? Rather, I would, another player may come into the stage is the private insurance companies. So they do have the incentive to manage health for their, you know, their members, right? But the challenge in China is that there's no quality health management provider yet. So even though the private insurance companies, they have the incentive, they probably cannot find the good health management provider. So that is the challenge they're facing. but at least that they have money and they have incentive, right? And I think as their presence is getting stronger in China market, this solution will be, solved gradually.
Great. The second question is about how do you think the public hospital reform in future of Chinese healthcare?
How do you think reform public hospital in the future? I'm not sure about this question particularly, but the reform, there's several themes of the reform, right? The public insurance, public hospitals, is mostly the content is tiered healthcare system, meaning the 分级诊疗, right? So that is the big theme. So meaning that the top hospitals should focus on most critical diseases rather than chronic disease management or smaller diseases. Those should be cared by the grassroots institute. However, the lower tier hospitals or primary care doctors, they are not have the people do not trust them. So people naturally think, well, if I really get sick, I still need to go to the big hospitals. And so that is the will, right? And also the willingness to pay, right? Because the reimbursement rate does not differ that much. For example, if you go to the class 3 hospitals, you get 70% reimbursed. I'm just picking up the number, right? And in grassroots institutes, you get 85 reimbursed. That difference does not mean too much. Rather, people think, I should better go to see the good doctors in big hospitals, right? So that's the second reason. The third reason is in some primary care institutions, the medicine is not complete. Say, for example, in some medicine like chronic diseases like the insulin, some more expensive insulin, people cannot get in lower tier hospital. They only can get in class 3 hospitals. That's kind of weird, right? Yeah, so people has to go back to the big hospitals in order to get the drug they need. Otherwise, they cannot get it in lower tier. So all those things are, patients do not naturally go to lower tier hospitals for like quick and lighter diseases, in my term. And also from the system side, class 3, like the big hospital and smaller hospitals, they do not have the cooperation mechanism, meaning that the big hospital still wants to absorb as many patients so that they can, identify which ones are more sick ones so that they can get into inpatient, right? They don't want to say, I do not see, I want to push the patients to the smaller hospitals. They do not want to do that because the smaller hospitals, they do not have the incentive to transfer complicated diseases patients to big hospitals. So kind of that, the big hospital and smaller hospital, they're competing for patients. Even though, a lot of patients they're competing at are low value patients, or but still because they cannot identify which patients are more valuable, so they're still competing patients. So if in other countries we have the referral system, so like the certain diseases, if the lower tier hospitals they cannot really take care, they has the clear route to refer to the bigger hospitals, right? So if they have that mechanism, things will get easier. But in reality, we lack that of mechanism currently. Yeah.
Great. The next question is, in China, we see that patients don't trust doctors. Do you see any innovative solution that try to solve this problem?
Well, yeah, I think, you know what, it is a sad situation, and this is a systematic problem. It's a long story. I think it's in short version, doctors are not get paid in a fair way. So they started to think about prescribe more or prescribe the CT or MRI, etc., to get some extra bonus, right? And patients thinks that, you know, the physicians prescribe to earn money from me, not helping me. So that comes from the how do I say, the systematic problem of the payment scheme, right? And I don't think, you know, innovation could be that, you know, increase some transparency. For example, which doctors are you know, more experienced or treating people more kindly, right? You start to see on some online platform, doctors getting, you know, the flowers or hearts, virtual flowers and virtual hearts sent by the patients, meaning that, you know, this doctor is you know, warm-hearted, something like that. But I think, you know, this may help a little bit. It does not help fundamentally. Yeah, this is the fundamental systematic problem. That's my answer.
The other day, I just went to the hospital. I waited for over an hour, and the doctor didn't even see me and start to prescribe MRI. That's exactly what's happening.
Yeah,
the next question is
but hold on,
about the online.
But hold on, let me add one sentence. If you are a doctor, if you have to see, you know, 200 patients within 4 hours,
go ahead,
without having, you know, drink, you know, some water or going to the bathroom, you know, you will do the exactly same thing, right? It's not like that, you know, this doctor is bad or that doctor is bad, right? A systematic way of setting up, you know, they have to see so many patients, which, you know, a lot of them are only, you know, just get the prescription, right? They have to pass, right? They push the patients out of their office as soon as possible so that they can finish 200 within 4 hours. So that's what I mean, the systematic problem, right?
Yeah, it's true. Sad. Hopefully it can improve sometime. And the next question is about the online healthcare consulting service is evolving in China for 10 years. How about service acceptance at the population? Not sure I fully understand the question. Do you understand, Li?
I think the question is around online consultation, right? So like a lot of like 好大夫 or 平安好医生, even us, you know, we do online consultation services. But people, you know, I think the services can solve some problems, like the really light and quick problems, especially like terminology problem, like you take a picture and doctors can see what's going on with a rash, right? They prescribe some medicine, or they do refill, right? People, chronic diseases patients, they do not need to go to the hospital every month to get their prescribed. So they go online and get some prescription, right? So I think pure online services can solve some problems. But again, as I stated in my previous presentation, I think online services and offline services has to be combined. It cannot be, only online, because a lot of scenarios, only online cannot solve the problem. And as simple as, you need to get your blood tested, right? How do you do that online? You do not do that online, and even you cannot prescribe the blood test for a specific local hospital, right? You can only tell the patient saying, I'm sorry, I cannot solve your problem. You go to the offline, hospitals. So that way, the patients or consumers, they will feel you do not solve my problem, right? That is not because the doctors online are lack of proficiency. It is because the system is not connected. I mean, the online system and the offline system is not connected, and the procedure is not streamlined. So if you can only provide separate online services, it is limited, yeah. But I see different players are doing this, targeting different patient scenarios. For example, refill, right? Refill you can do. Especially refill without the insurance coverage. If people do not care about the insurance, or the drug is not covered by public insurance, they can, go online and get prescribed and product mailed or delivered to their home. So that is a sort of a loop, right? Really can solve the problem, but it's I would say it's limited if it's pure online.
Okay, we'll switch over to the chat box and go through some questions there. The first question is from our Chicago booth alum, David in Chicago. It's a kind of a question and a networking request. Booth alum with financial service compliance, data science, real-time, and creating real-time decision-making. How can I use the transferable skills to help bring outside thought and innovation?
This is quite long. I do not see the questions. Which one is the from chat box, right?
Yes.
Could you read that again? I'm sorry, I didn't catch it.
I think David is trying to ask how he can bring his experience from financial service industry, data science, real-time decision-making to the healthcare industry to sort of, bridge innovation and outside thoughts experience.
Wow. Well, that is a, big question.
Yes.
I would,
well,
I'm sorry, I don't think I can give, satisfactory answer today, but my first reaction is, I think the fundamental technology could be, common. However, if you really, use your technology in a usage scenario, I'm sorry, I only know this word, usage scenario, you have to understand, how the doctor works and how, what the medical knowledge is and the terminologies and the clinical logic between those terminologies, and what is the decision tree, et cetera, et cetera. So, I would say that is the common technology plus domain knowledge. These two, at least these two needs to combine and work out for some usable applications. Yeah. but yeah, but I think, you know, the basic technology would help. Give you an example, right? So we do the image diagnostic, for example, doing CT scan. The AI engine scan the CT and you know, diagnose whether this nodule would be cancer or not cancer, right? This kind of thing. So a lot of companies doing that, and we did that too. But we managed to develop that quicker and with much more precision, because, you know, we have the basic technology on Taobao. Because, you know, on top, that is, you know, strange, right? It sounds strange. But the underlying technology is image recognition. So we do have a application on cell phone Taobao called 拍立淘, meaning that if you take a picture of this product and the engine could search the similar product for you online, right? So this is the function on 手淘. If you guys don't know, I will let you know where you can use that function. But underneath technology is the image recognition. Yeah, so we managed to apply this basic technology into CT scan diagnosis, and we were able to develop that faster.
A couple of people are asking whether they can follow up with you after the session. I guess we'll get Lee's email and share with you towards the end. The next question is, has the digital healthcare solution been implemented in somewhere in China or somewhere in other countries? I think the answer is yes, right? It's quite obvious. That's why we are organizing this session today. In China, there are players like Alibaba Health, Ping An Doctor, We Doctor, and in the US, there is a famous case, Tele Doctor. They are doing quite well also. I guess let's move to the next question. I think the time we're going over quite a bit. What good practice have you seen in lifestyle management from healthcare perspective?
Well, yeah, that is a very challenging area to tackle. I would say that I do not see the successful or mature models yet. But there are several areas I think we can focus on. One is the annual checkup. So that is the routine people are accepting, which also, you know, can be valuable, right? That diagnose some early stage diseases, and yeah, if the annual checkup can draw enough attention of the patients or consumers, they start to realize, yeah, I have to, you know, change my lifestyle, right? Or take some medicine at the early stage. That is tremendous help. So that is one thing. The other thing is chronic diseases management. So in China, the compliance rate is quite low. Compliance rate meaning that for chronic diseases, for example, the patient should take the pill every single day, right? 12 months per year. But in China, you know, after several months, for example, hyperlipidemia, people say, yeah, you know, my 高血脂 hyperlipidemia is controlled, so I will stop that medicine, right? So the average compliance is 3 months in China for hyperlipidemia, versus in US is 9 months. But the 6 months difference means that after several years, the complications rate would differ quite a bit, right? And we mentioned earlier that if you lead your disease to the critical stage, the healthcare system needs to spend more than $100 versus, $8 to treat that, right? So that is, you can see that is the curve, right? People need to get their chronic diseases managed. And the simple way is to compliant with the doctor's prescription. And if the doctor asks you to take the pill, you take the pill, right? But in China, it is not the case. So it's relatively easy for the patients to be more compliant. With that, the insurance companies will see benefit in the longer run. Even for the insurance too, right? They'll see the benefit in the longer run. So this man has a lot. It's the area, the alignment, the area provider and so and other than that, people try to correlate to like the lifestyle they stop eating organic. So we need to find some way in this payments, with and yeah, so ensure the and great is easy to
Can everybody else listen well? Lee, I think your internet is always at me. Hello? Lee, are you there? Lee, I think, Lee, you need to either sort of try it again or, yes. Sorry, everyone. Lee will log in again. We will see whether we can go through a few more questions. Hi, Lee. Welcome back.
Sorry about that. Connection is not stable. Back and was.
You know, I always have Wi-Fi. I tend to have a Wi-Fi issue, so I always use 4G for Zoom, and it seems to be working better than Wi-Fi.
Oh, next time
It's still not very clear.
Oh.
I would suggest. Okay. Sorry. How many people? We have 23. Hang in there. Lee will try to log in again. There are some good questions. We can go through it since we already are on the call.
Well, now I'm on 4G. Is it better?
Much better.
Is it better? No?
Great. Yes, it's better. Much better. So there are quite a few more questions. Let's go through them quickly. There is a question about there are lots of digital platforms to choose from. What are good business models to generate qualified leads and continuously engage the users?
Is it better now? I'm back with 4G.
You are much better.
Okay, I'm sorry about that.
So did you hear the question? Or let me repeat. The question is about there are lots of digital platforms to choose from. What are good business models to generate qualified leads and engage the users?
In the perspective of the patients or in the perspective of doctors?
I think it's meant to be patients, qualified leads.
Qualified leads.
Leads
So,
being
yeah.
patients to use digital platform. That's what I understood.
I think probably the question it's asking from the doctor's perspective, which online platform to choose, right? Because generate leads, I think generating the good patients. That's what I understand. Yeah, I think well, it depends, right? I think different platform are having different advantage. So for example, the 平安好医生, right? They are more connected with the healthcare, like the private insurance, but they are kind of a closed group of doctors because they're self-owned or self-hired doctors. So it's not an open platform, right? Like 好大夫、春雨医生、微医 and us, we are an open platform. So we welcome the physicians. So I think it depends on, the doctor's view, which platform the service is better. The service meaning the platform provide a service to the doctors, meaning that whether they can identify good leads, for example, like identify the good patients, the doctors are more interested, or are there patients at all, right? Because you know, for online platform, a lot of the patients are not really understand how to use them, rather than to just to consult, ask some simple quick questions, right? These are the not serious platform, I would, in my mind, right? So whether the platform has the capability to get into the medical logic or medical the capability to, why do I say that? Because, you know, if you could really understand what the patients are the questions are, what problems they are having, so that they can match what kind of doctors. So they do need to have medical capability. I'm not sure whether I state that clearly. Yeah, so otherwise it is not a, you know, it's not a traffic business. Let me put that way. It's not a traffic business. It is more of identifying or understanding the patient's problem and then find a match, right? That way the patient thinks, well, you know, your doctors are really solving my problem. And on doctor side, they think your platform can bring real patients I'm seeking, right?
Okay, we'll go through two more questions. One from Emil from the US. What do you see the role of payments to be in healthcare? C, for the improvement of care, such as customer experience and incentives. Emil work on the above here in the US.
Payment, by payment meaning that in the insurance coverage or the payment action. If I, you know, let me answer through different angles, right? I think the payment action is the action you cannot avoid. If no matter you go through, you know, offline, you know, hospital visits in China, you have to pay at the same day, right? It's not like in US, you get a bill after, you know, a couple months, right? So you have to pay. So in China, especially in the crowded hospitals, you have to wait in line for hours to pay. And more painfully, during one visit, you probably have to pay 3 times. You know, one is registration, one is pay for blood lab result, lab testing, for example, and the other one is pay for the medicine you're getting, right? So the payment action is quite painful in China. It's not, you know, in US, I don't think it is that painful. However, you know, in China, if you can do online payment, even though you in the hospital, it's not online, right? In the hospital, but you pay through your cell phone. That already bring a lot of convenience. And also, I think the technology involved there is, you know, how much you should pay out of pocket and how much goes to the insurance, right? If you can calculate that, that means that you have to connect it with the public insurance center, and you have to know the patient's situation, like their social insurance number, right? So that you can know what the coverage scheme they are under, and then calculate for this visit, right? So there will be a lot of data technology involved already. So that is only for payment, right? And if you are, your question really means for insurance, for the payer, right? That even more important. So for the payer, it is more of, you know, what is the payment scheme you are imposing? And for private insurance, you know, what is the payment policy you are giving to your members, right? So that will change or guide the doctor's behavior, like how much, you know, prescription they will extra the prescription that they want to do, right? Yeah.
Great, thank you. Let's conclude it here. There is a question about whether the recording will be sent out and post somewhere. Because Lee work at a public company, so the recording will be sent to their PR for review first. If it's okay and approved, we will share the recording with everyone. Thank you very much, Lee. This is very informative and insightful. Again, I wish that we invited you for this sharing much earlier. I would have hold on to my digital healthcare stock.
Thank you, everyone. Right. Yeah.
Thank you so much.
Yeah, thank you. Yeah, maybe I can send you the QR code of my WeChat so that you can publish somewhere.
You can actually post your email address in the chat room, please, and send it to everyone so everybody can see it.
Okay, let me do that, but I may not check my email very frequently. Let me.
Because some people are in the US, so they probably won't be able to have WeChat. Let me post and send it to all. Have to send it to all.
Right. Yeah, but if I do not reply your email, it's not I ignore you. I just don't check my email that frequent.
Okay, great.
All right.
Well, thank you again.
Thank
you. This is great. Okay. Thank you. And thank you everyone for staying with us for being quite long. Yeah, thank you.
Thank you.
See you next time.
Yeah, see you. Bye-bye.
Stay well. Bye-bye.